You are halfway through a run on a hot afternoon. Your heart is working, your muscles are burning, but your skin is completely dry. That sounds convenient for about 3 seconds. Then the temperature inside your body keeps climbing. No dripping forth, no dampstjert, no warning puddle of sweat. Your most powerful cooling system has silently switched off. And if you keep moving, the heat you create has nowhere effective to go. This condition has a name, anhidrosis, the inability to sweat normally. In real life, it can affect one area or the whole body and may be linked to skin damage, dehydration, medicines, nerve disorders, or inherited conditions. Our hypothetical is more extreme. Every working sweat gland stops at once, while everything else begins healthy. What happens next depends on where you are and what you do. First, meet your internal thermostat. Temperature sensors in your skin and deep tissues report to the hypothalamus in your brain. When you become too warm, it sends signals that widen blood vessels near the skin and activate millions of eccrine sweat glands. Warm blood carries heat outward. Sweat reaches the surface. As that water evaporates, it takes heat away from the skin and indirectly from your core. Evaporation is the crucial part. Sweat that merely sits on your skin is not doing its full job. Moving air helps it evaporate. High humidity slows evaporation because the air is already carrying a lot of water vapor. Clothing can trap heat and moisture. And once the air becomes hotter than your skin, radiation and convection can stop helping and may even add heat. Then evaporation can become your only effective escape route. Now remove that route. In a cool room, sitting still, the disaster may not begin immediately. You can still lose some heat through radiation, convection, conduction, breathing, and tiny amounts of passive water loss. You can move in a shade, use a fan, remove a layer, or touch something cool. This is why there is no honest countdown that applies to every person in every place. But return to our runner. The air is 35 degrees Celsius, or 95 Fahrenheit, and the muscles are producing far more heat than at rest. The hypothalamus sends the order to sweat. The glands do nothing. Skin blood vessels widen, sending more warm blood toward the surface. But the missing evaporation means that heat keeps returning to the circulation instead of leaving the body. Within minutes, the cardiovascular system has to work harder. More blood is being requested by active muscles and by the skin at the same time. The heart beats faster to defend blood pressure and move heat outward. The face may flush. Breathing becomes uncomfortable. The dry skin is not proof that everything is fine. In this scenario, it is the warning that the cooling response has failed. Your first useful symptom may be a feeling that something is wrong. Unusual heat, weakness, headache, nausea, dizziness, or poor balance. Attention narrows. Decisions become slower. A runner may miss a curb. A warehouse worker may misjudge a moving load. A driver may react a fraction too late. Rising heat is not just a thermometer problem. The brain begins losing the precision needed to keep you safe. Drinking water still matters, but it cannot replace sweat glands. Water supports circulation and protects against dehydration, yet a bottle inside your stomach does not create evaporation across your skin. Pouring cool water onto the body is different. Now, an external layer can absorb heat, and airflow can help that water evaporate. The missing biological system has to be replaced by the environment. If heat storage continues, the situation can progress toward heat stroke. Doctors do not define the emergency by heat alone. Brain dysfunction is central. Confusion, strange behavior, slurred speech, seizures, or loss of consciousness mean the temperature control system is failing. A core temperature around 40 Celsius or 104 Fahrenheit is a classic danger sign, but nobody should wait for a perfect number before getting help. At this stage, heat can injure cells throughout the body. The brain becomes disorganized. The heart is strained by high demand and changing circulation. The gut barrier may become leaky. Inflammation and abnormal clotting can spread. Muscles can break down, releasing material that burdens the kidneys. The liver and kidneys may begin to fail. This is why heat stroke can cause permanent disability or death even after the person leaves the sun. The setting changes the speed. In dry air with strong airflow, normal sweat evaporates efficiently, so losing it removes a huge advantage. In high humidity, even a sweating person struggles because evaporation is blocked. Someone who cannot sweat starts with no evaporative defense at all. Heavy clothing, direct sun, fever, certain medicines, and hard exercise can push heat gain higher. Cool water, shade, air conditioning, and stopping activity pull it lower. So imagine two identical people after the switch. One is reading in an air-conditioned room and notices almost nothing at first. The other is climbing stairs in a hot building. Their bodies have the same missing function, but their heat balance is completely different. The second person may deteriorate quickly because every step creates more metabolic heat, while the surrounding air refuses to take it away. If someone becomes confused or collapses in the heat, treat it as an emergency. Call emergency services. Move the person to shade or a cool area. Remove unnecessary outer clothing and begin rapid external cooling while help is coming. CDC guidance includes cold water or ice water immersion when possible, wetting the skin, circulating air, and placing cold wet cloths or ice around the head, neck, armpits, and groin. In a hospital, the priority is still rapid cooling, followed by monitoring and treating complications. Teams may check core temperature, heart rhythm, electrolytes, kidney and liver function, clotting, and signs of muscle breakdown. The exact treatment depends on the cause. Someone with chronic anhidrosis may need strict heat avoidance, cooling equipment, activity planning, medication review, and specialist care rather than a magical way to switch every gland back on. Sweat feels messy because you usually notice the moisture, not the heat it removes. But on a hot day, every evaporating drop is carrying invisible energy away from your body. Take that system away, and ordinary movement can become a thermal emergency. So the next time your shirt sticks to your back, remember what your body is doing. It is spending water to keep your brain, heart, kidneys, and every other organ inside a survivable temperature range.